old is too old to be going through perimenopause? If you're in your 50s, have you ever wondered, am I the oldest person to still be in perimenopause? Because we are hearing a lot about women in their late 30s and 40s going through perimenopause. Everything is hashtag, over 40 crowd. But what about the hashtag over 50 crowd? Yes, I want to break it down because I have been getting this question so much recently in the comments. I'm going to talk about what's actually considered normal in menopause timing. We're going to talk about some labs that you could consider. They're not required, but they're maybe helpful when it comes to menopause and menopause timing again, like what blood work you could maybe run. What will birth control or a progestin IUD or hormone therapy do to your menopausal transition? And then we'll kind of wrap it up with like some last minute thoughts. So first things first, if you are in your 50s, you are not too old. I just want to get that out of the way right now. But I know it can feel old, and people have probably made you feel old. Like maybe you've gone to your doctor, you're 54, and they're like, 54? You still get your period? That's old. No, it's not. The definition of going through menopause, like the doorway of menopause, is when you've had your last period and for 12 consecutive months, you don't get another period. Now, if you had an ablation or progestin IUD, I'm going to talk about that in just a second. But the actual definition of 12 months, no period at an appropriate age. The average age a woman, especially in the United States, goes through the doorway of menopause is between 51 and 52 years old. So let's say 51.4 is the average, or 51.5. I can't even do math. 51.5 is the average age a woman goes through menopause. That means it's the average. So some women have to be older than 51.5, and some women have to be younger than 51.5. Now, the reason we're hearing so much about women in their 40s and even late 30s is that perimenopause is a 6 to 10 year transition. So this whole transition up to the average of 51.4 could start someone in their late 30s or early 40s, but it may not start for you until 45 or 48, which would mean you're not going to go through it until your 50s. Here's some interesting data. Something like 5 to 10% of women go through the menopausal door over the age of 55. So if you're listening to this and you're like, yeah, but I'm like 57 and I still get periods. Again, there's nothing wrong with you. You are just on that end ahead of or beyond the 51.5 as opposed to being younger in your 40s, and that's okay. About 1% of women are still in perimenopause older than 60. I don't know that I've actually met a woman in her 60s still in perimenopause. I met one woman once who told me her sister didn't go through menopause until 60, and she was in her 50s. That was but she herself was still in perimenopause, so she was like, I think I'm just going to be a late bloomer to this. And I was like, that's okay. That's okay. There's nothing wrong with you. Your sister went through at 60. If the other women in your family went through later, good chance you're going to go through later also. I will give you my own example. My mom didn't go through menopause, the doorway of menopause, until 54, and I'm pretty sure her mom didn't go through until 54 also. I am in my late 40s. I'm almost 50, and I'm solidly perimenopausal with regular cycles. So I'm pretty certain that I won't go through the door of menopause until my probably early 50s as well, which of course is again normal. 51.5 is the average age. You can be a little ahead of that. You can be earlier than that. There's nothing wrong with you. It's just you. And there's this big range. But I understand because on social media, if you're in your late 30s or your 40s, that gets talked about a lot. Okay, let me give you some other statistics that might help. If you have skipped 3 periods in a row, research says you'll probably become menopausal, go through the doorway of your last period ever, within the next 4 years. Now, 4 years seems like a long time away, don't get me wrong, but it's not 10 years. And some other research even says 1 to 4 years. I have had a few patients in my career who said, I had regular periods. One day I got my last period and it never came back. I didn't do the skip period thing. I didn't do the 2 in 1 month thing. I had periods, they stopped, and that was the end of that. A lot of women experience the opposite, where they start skipping periods and then their period comes back, then they skip periods and then it comes back, or they'll get 2 in a month and then they'll skip. Like it's kind of all over the board, but it's possible you're also listening to this going, yeah, that's me. I had regular and now they just stopped. Or you're going to be like, no, I'm in the skip category. So if you've been skipping 3 in a row, within the next 4 years, let's say, the next 1 to 4 years. There is other research that says if your cycle, again, is like 60 plus days, 95% chance of becoming menopausal, going through the doorway of menopause in the next 4 years. So 4 seems to be that magic number. But again, it's like 1 to 4 years. So, like it's just like once you start skipping, some people think, oh, it's right around the corner. It's like I'm right there. And you might be, but it might be in the next couple of years. But it's not 10. Like, whew, like it's not 10. You're winding down. You're just not quite there yet. Let's talk labs. Most practitioners don't run labs because we don't have any kind of lab that will tell you here's the day, the time, the month, the age you're going to go through the door of menopause. However, we have some labs that could be helpful. And if you had an ablation, a uterine ablation, or a uterine hysterectomy, so you still have your ovaries, or maybe you have a progestin IUD, such as a Mirena, a Skyla, a Kyleena, it's probably been suggested to you run the blood work called FSH, follicle stimulating hormone. And the reason for that is if FSH goes up, it means your follicular ability in your ovaries to make hormone and like release an egg is going down, down, down. So the higher FSH is, it's like, ooh, you're getting closer, closer, closer to menopause. Most research says, most lab reference ranges say, once you're above 25.8, some labs say above 30, you're considered menopausal. Now, a one-time blood test is not ideal because FSH can bounce around. So some women will go, yeah, I didn't have a period for 6 months. I got an FSH. It was above 30, but then Murphy's Law, I got my period back and my FSH dropped down to 18. So I'm like, all right, you were really close. You were really close. But if you have an FSH above, let's say 30, and then you still don't get your period, or maybe you have an IUD and you're like, let's check again in 3 months, and now it's above 50, like you're probably through the doorway. You're probably postmenopausal. So FSH can be a nice one to give you an idea of like you're close, but close isn't like tomorrow. Close might be, again, 1 to 4 years. Which leads me to another marker that nobody runs. Nobody runs this marker, but I am really tracking it in research articles because I find it super fascinating. It's called inhibin with an I, inhibin. You have inhibin B that comes out in the first part of your cycle, the follicular phase. You have inhibin A that comes out in the luteal phase. Now, inhibin B tends to decline first. So in the order of hormonal changes, inhibin B tends to go down, FSH tends to go up as a result. So there is research when they're looking at both markers, inhibin B and FSH, that to do an inhibin B test, if it's really low, in fact, one research paper said if inhibin B is really low, like low in the reference range or below the reference range, like you are probably within a year. And I was like, well, hot dang, that's really great feedback for women to know. I mean, 4 years is a long time, but if I knew I'm probably within a year, like, let's throw me a party, right? So, and you can test both inhibin A and inhibin B. If they're very low, you're very close. Inhibin B is what most of the papers are looking at, though. Now, we have a long way to go. Nobody's looking at this marker, really. Nobody's testing it, and so it's not guaranteed. I can't be like, yeah, go run this marker, go ask your practitioner for it. They probably potentially have never even heard of it, but it is a key part of the menstrual cycle. Like one goes up in the follicular phase, one goes up in the luteal. I don't know why they're not talked about very often. We only pretty much talk about, of course, estrogen and progesterone, and we talk about LH for ovulation, and we talk about FSH for follicles. That's kind of it. But like you have 2 inhibins in there as well. So inhibin is an option. I'm going to keep my eye on it in the research. I might test myself, be a guinea pig. I've never actually had it tested, but I have been kind of tracking this hormone just to see if it gets picked up lately. If you are a curious cat, if you're in the healthcare field, if you have a very open practitioner who wants to learn these things too, then check out, price out inhibin and inhibin B and see where you are at relative to your FSH. Okay. Lastly, we get to hormones. If you were on the birth control pill, I mentioned the progestin IUD, such as a Mirena, a Skyla, a Kyleena is an example, or you were on menopausal hormone therapy of some sort, then you may be solidly perimenopausal, but all of your symptoms are alleviated because you're on hormones. So I have had women say to me, Carrie, I have no symptoms. I have no symptoms. I am a unicorn. And then come to find out they're on the birth control pill or they're on, hormone therapy. So of course they can feel amazing. Of course they don't have any hot sweats or, night sweats, or their energy's pretty good or their mood's pretty stable. And on the birth control pill, you get the withdrawal bleed every month. It's not a period, it's a withdrawal bleed, but still they get regular bleeding. So they're like, Carrie, my cycle's still regular. Like, well, the birth control pill does that. That's part of its job. So not really. Like, yes and no, you bleed regularly, but it's because of the pill. Or, they're on menopausal therapy, so they'll say, well, I'm on estrogen and progesterone, so I'm sleeping well, I don't have any hot flashes and night sweats, I'm feeling like a queen. And that's what it's meant for. Like, I am thrilled, but it doesn't mean you aren't perimenopausal. It just means that you're on something that's aiding you. And I don't want you to confuse that with like, oh, I'm not perimenopausal anymore because all my symptoms are gone. And so I just wanted to like put that out there. Now, the progestin IUD is really helpful for a lot of women for the uterine symptoms. Heavy periods that can come, clots, cramps. So they like the progestin IUD, but the progestin IUD does not help the systemic symptoms like the vaginal symptoms or like the musculoskeletal, syndrome of menopause, the joint pain, the muscle pains, the sleep issues, the mood changes, et cetera, et cetera, et cetera. So you may find that you still need systemic therapy in addition to your progestin IUD. But if somebody said to you, are you having heavy periods in perimenopause? You may go, no, thank goodness, because you have the progestin IUD, and that's one of its roles in the body, which is, fantastic for women who use that and need that. So I wanted to cover that because, again, sometimes I get people who are like, I have no symptoms. And I'm like, oh, but you're on hormones. Like, it's doing its job. Thank goodness, right? Okay. Lastly, symptoms in general. I was at an event many years ago where I met a woman who said, I didn't have any symptoms of perimenopause. None. I sailed through it, which was amazing, except she had to have something to assist her to walk. And she had a lot of cardiometabolic symptoms that I could see, which are heart and, glucose, insulin, obesity, etc., like very apparent. She was in a lot of pain. She had a lot of joint pain and muscle pain, which she told me. So I clarified with her, like I'm glad you didn't have any symptoms, but what symptoms did you avoid? To her, it was hot flashes and night sweats. She said, I've never had a hot flash or a night sweat in my entire life, which is amazing because the large majority of women at some point in their life, no matter their age, you can get a hot flash at any age, quite honestly. It's a hormone triggered thing, but she'd never had one. However, she obviously had the cardiometabolic part of perimenopause. While there are other risk factors for that, don't get me wrong, the change in estrogen in particular, but also progesterone, plays a role in that. And if you've read or evaluated musculoskeletal syndrome of menopause from Dr. Vonda Wright and those authors, then again, like the change in estrogen plays a big role for a lot of people in their muscle and joint health, and even in their glucose, insulin, metabolic health as well. Again, not the only factor, but a big factor for a lot of women. So just because you've never had a hot flash or night sweat, or just because you still sleep great, it doesn't mean you aren't necessarily in perimenopause. It's possible just because you have other symptoms going on, such as maybe mood changes, you've noticed joint pain or muscle pain, hair changes, itchy ears, like you've been noticing other things in your lab work, like can all kind of point to perimenopause. Now, I say all of this because I need you educated, for one. But for two, also, I want you to be aware that there is a lot you can do. So no matter if you're going through perimenopause in your 40s or you are in your 50s, like it's still a great transition. Like you're going to come out the other side is this total queen badass, this whole potentially new person with new boundaries and like a great, like better attitude and who you come more confident in who you are and what you've gone through. You made it through puberty. You did puberty and you had no idea what to expect with puberty, right? Now with perimenopause, we have so much education out there. Like now you know what to expect. So you're going to take this by the horns and you're going to take control. Like this is your health, how you make this journey, like you got this. So 51.5 is the average. I wanted to address if you're on the other side of that, you're older than 51.5, there's nothing wrong with you. It's just you. You're just on the other side of 51.5. You will go through the doorway of menopause eventually. If you want to do some of this lab work and see maybe how close you are or aren't, great. If you don't, if you're like, this is all I needed to know, I just need to be reassured I'm not the oldest person in the world to go through perimenopause and someday I'll go through the doorway, you will. I promise you. So hopefully this has been helpful. Hopefully this helped like put some puzzle pieces into place because I don't want you worried. I want you honestly like feeling like you got this, feeling like you're going to grab it by the horns and you absolutely got this. So I know hormones can feel like herding cats, especially when you're not really sure what's going on and you've got this 6 to 10 year window, but you might be in a 1 to 4 year window. Like, what in the heck? But I am here to help. I'm here to educate and I'm here to like make it real for you because I'm right there with you.